morning, everybody. Again, this is Dr. Omar, and we have Therese, the best hygienist ever and patient advocate. Good morning. So last time we were talking about dental implants, and
Yes.
and we focused more on single implants and how we do that. In today, we're going to be talking more about full implants, dental disasters, how we can recover from from a situation where it's hopeless to a situation where it's completely life-changing. Why, and that's actually a very interesting topic, and it's very dear to my heart, and that's where we talk about why dental implants are important over here.
Yeah, same. I feel the same. Just like how you said disaster, and I was just thinking like a house. You just sometimes you got to build new.
Yeah. So it's interesting we say that because most people, what we see is most people around age 45 or 50, they start having an issue with their teeth. And they actually, at the beginning, they start blaming themselves.
Right.
But we had to realize one thing, that we get our teeth at age 6. By age 10 or 12 years old, we have most of the permanent teeth are in. And what's interesting is tooth number 6, the 6 years old actually molars, they are usually the first missing because we get them at really early ages, and that's usually we end up losing them because we're not brushing, we're eating the most sugar at that point, and that's a story. So if we count like average of our teeth, we get them in at age 10. When you're 50, that's 40 years.
That's a lot of work. I mean, do we expect our cars to last that long?
No, so it's basically 40 years. So it is normal to, when you're 50, to start having major issues with your teeth. There is nothing in this world that are on our own bodies that's gonna last working 24/7. I mean, the teeth are the only structure in our body that does actually work 24/7.
Right.
You go sleep and you sit grinding on it, clenching on it, and do that. Other than not the only structure.
And
we
just
have
the
heart
joints,
and all that.
the whole system.
Yeah. So and that's where we feel like most of patients, they come in at age 50 or 45 or 55, they're ashamed.
Right.
They feel like, oh my God, I don't know what to do, but I've been fixing my teeth. So this is our normal patient story. This is where we see everybody around that age is they've been trying to take care of their teeth for the last 30 years, and they do very well. They do root canals, crowns, they see the dentist. They may hate the dentist, have anxiety because of some experiences, but still they do their best to keep their teeth, just to be able to smile, just to be able to function and chew, go to a restaurant and eat something. But at age 50, it's getting annoying. You feel like you're stuck in a sinkhole where it's every time you repair something, something else breaks. Just like driving a 300,000 mile, car, right?
Yeah, it's a perfect example with my husband, not to interrupt you, but
Okay.
he's got a 1997 Toyota
Okay.
Avalon. It's funny, we call it the golden turd. You can cut that out. But it is.
No, it's good.
It is, but that's what we call it. The kids are like, no, we don't want to drive in that. But it's got like over 200,000 miles. It's Toyota, okay? Yeah. But like his muffler broke, and we were talking the other day, and he's like, it's like $1,000 to replace my muffler. He's like, that's almost worth more than
the car itself.
So that's a perfect example.
I sold my '96 Honda for $250.
Well, that's
FYI.
We've put a lot of money into this. It's still running. Good job, little guy. I hope he makes it.
But that's a very good example, and that's a very important conversation. At one point, you get to the decision you have to make. Should I keep patching the work? And it's okay if it's not that expensive. It's okay if you're spending $200 here, even in your teeth, $1,000 here or there.
You said no to the muffler.
Yeah, you said no to the muffler.
I mean, I didn't realize that if you need a whole muffler, I want to say it's $1,500.
Oh wow.
I mean, we'll just go get a new car.
Yeah, so at one point you had to make that decision.
You have to make a decision, and it's hard.
I want a brand new car. I mean, this is 1997. That is 30 years almost. So and that's where you say, it is time to get a brand new car, new house, where you actually good for the coming 25 years. That's exactly what dental implants are.
And I can't tell you how much anxiety that causes George having that car. Is it
Really?
going to break down today?
Anytime.
It's loud. It's embarrassing. The kids hate driving in it. It's exactly how we feel about our mouths. Like, you can relate a lot of things into life that it's very common to have these things happen, and we have to know nothing's going to last forever, but you don't have to be stuck.
Yeah.
If you want.
And it's okay to feel that. I feel like people understand the cars.
They do.
but they don't understand the teeth example. They feel like, oh, I'm beating myself because I didn't take good care of them. You know, to be honest, few of people actually, there was a study done in Japan actually, and it says that average age of teeth is 46 years.
Yeah.
So if you're thinking about it, you got the teeth at age 10, you know, by 55, 56, it's rarely these teeth are used. Now, there is people who can keep their teeth for the age 90, but with the type of food we're eating, with the type of soda we're drinking, with the type of medications we're taking now, saliva issues, we live longer these days.
That's such a good point.
Yeah,
that's what the biggest point is. That's why this is needed more than ever.
Because I think the average woman lives longer than men.
Yeah, it's 85. I want to say for.
You guys give us heart attack.
We get you know.
Anyway,
you guys, you know.
But I think the average woman is 85 to 92.
It is, yeah.
And average men, I think 80, 75 to 80.
And that's why this is becoming so huge. Because before you're like, well, I'm already 70. I'll just do dentures. I'm going to live 5-6 more years. But no, I mean, you got 10, 15 years to go. And like my dad, he's retired. He's in a retirement club. You know, he plays billiards with his buddies. And he was just talking to me. For years, I've been telling him to, you know, get some implants and fix his teeth. He's missing a lot of teeth. And he's actually now, he's like thinking about it. He texted me the other day and I was like, I think it's because he's part of this community club and he's embarrassed by it at this point. And I would share a personal story that happened with me, and that's why I'm personally very passionate about dental implants. I would mention my grandmother's story. Yeah. So what happened, I went to dental school. I never knew that she had dentures. She was very secure about them, would never take them out. She lost her teeth around age 60. There was like no implants at that point. You know, till I graduated from dental school, I was like, you know, then I realized she had dentures. I talked to her, she's like, you know, what is it, brand new kids, you know, new dentists understand. Everything was good till she is aged 87, actually 86, and she's a very healthy woman, completely independent. And what happened, I was traveling with her across the border, and she actually threw her dentures away. I know she put them in a napkin. That's how most people lose their dentures, throw them away. And at that point, I knew it's too late to do anything. She's so attached to him.
We're 4 dentists in the family. We couldn't do major bone grafting at 87 years old. We couldn't get her a new set of dentures to get used. The only reason these dentures work, you know, because they're just basically part of her body for 40 years. Right. There's no much bone left. Right. And she left till 97. And for 10 years, this is a lady that never showed up between, you know, showed people that she doesn't have teeth. Now she lived the last 10 years completely healthy, no teeth. She gummed her food. It was a disaster. And seeing that, I wish, for example, if at one point at age 60 we place some implants in there, okay, and then you would never worry if you lost your denture implants or anything could happen. You have a foundation to work on. And that's why we love dental implants, because the second we introduce it to the system, you can buy 25, 30 years, and even if things happen, you can always work around it, and you're good to go with that. Yeah, and I just love, and I think we touched on it last time, but I mean, the first 18 months is when you're going to notice something. So if there's anything happen.
Exactly, and we're here with you during that, so we're going to catch issues early on and correct them, but it's a lifelong change. It's a life changer. I mean, we'll talk about that in a second. But do you remember any patients specific that have a special story like change their life? I have one. There's so many.
So many.
I mean,
right?
there are really, truly, not even just dental implants, but just the anxiety in general, which we'll talk more about.
What about the patient who?
I mean, Kevin, who I met for the first time. He was with me for a consult.
Yeah.
His wife got it done. He told me his first visit, I think it was more fear than anything else, because his wife was like, I got it done, I love it, you can get through it. It's a journey, we're not telling you it's rainbows and butterflies, it's some ups and downs, we're right there with you. But it is a journey, and I think he was just nervous to lose his teeth. He had all his teeth, they were
that is a fear.
It is a fear, because think about, I would feel that way, like that's, a lot of people feel, they want to take them home with them, a lot of people are attached to them. They've been with you, they've been through a lot, So I think that he didn't want to he had really bad gum disease, so the teeth were just hanging on. Yeah. Severe infection. I mean, severe infection in the gums. And we started with just a heroic gum cleaning, because that's all he would do at first, but he loved the sedation. And then we worked him into finally getting the teeth out, the implants in. He just came in yesterday. He's so happy.
Yeah, I saw him
he's
yesterday.
hi, and I just love seeing him because he came in like this, like almost a scared little boy.
So let's talk about that because
you know,
because a lot of people, they are stuck about losing their teeth, and it is a major decision to decide to to jump over this barrier. It's like, I'm not gonna lose all of my teeth. Well, you can keep them, but you need to realize at one point that anything we do in dentistry, it's another 7 years or 5 years batch, which is fine. We can do that. We do that with a lot of our patients where we can babysit the teeth, we can keep them, but that's not a long-term fix actually. But the second you get the long-term fix, you're solved. I will mention another story. It happened actually in 2016, and we have a patient named Carolyn.
Oh, I know.
And
I love this story.
She sent us a letter through email in the website actually, and it says, please help. She got her teeth out 3 years ago, 3 years before that letter. And then what happened is she couldn't get fitted to dentures. She hated them. She literally wrote down, "I look like a donkey," on that letter. I still have that letter till today. And then she actually been in her room in her house for 3 years. And it's interesting because she helps animals. So any
I love.
what's that?
Which I love.
Which I know she helps animals with no shelter. She shelter them, take them if they are completely ill. She tried to take care of them so they recover and release them again. And she was just asking for the help. She'd been to multiple dentists, they couldn't help her. It took us 2-3 weeks to just get her in the office. That's how much she was terrified of the dentist, and she was so ashamed of her feeling. And she did say, if you guys don't help me, I'm thinking to commit suicide. And because think about it, she was 55 at that point. And if we really think about 55 and above, the main thing we do in our life is socialism.
So
we go social, we don't, everybody's retiring, everybody's going,
Finally have the time.
Finally have the
You're
time.
not at work all the time.
Then you're ashamed of your look and ashamed of function. You can't eat anything. Then how are you going to socialize, right? So that actually, we were able to bring her in. We were able to do implants with her. It's so amazing how we changed her life. She actually showed up a year ago. She had some heart issues. She said, I don't care as far as I have my teeth in.
Right.
It was just so amazing when you see a person, being ready to commit suicide, been stuck in their room for 3 years, been ashamed about their teeth, or every time they smile, they're putting their hands on, or having continuous pain, or they can't chew a steak, or they can't eat. And then all of a sudden, you get them within 6 months in a position where they are good for the rest of their life. It's been now 10 years. Extremely happy, no issues, and it's ready to go for another 20 years.
And when is good nutrition most important? Around that, really, your fiber stains you need to chew. I have patients telling me they choke on their food, they're chewing it full pieces, they have digestive issues. We live in America, so reality is a lot of people have digestive issues. We have a lot of ingredients that don't agree with people's bodies, and you want to eat the foods that are healthy and that are full and straight from the ground, and those are the foods that are the hardest to chew on,
100%.
And that makes the world of a difference for someone. Just the taste alone, even that's a big thing too, is the taste of the food. I had somebody yesterday. Every day I talk to people. It's a lot of stories.
It's our daily life.
But she was telling me how she's not even hungry anymore because she misses the taste of her food. She's not enjoying it. She's
think about eating a steak with a plastic
no
knife or a plastic fork. It just you can eat it at the end, but it's a painful experience. So let's talk now about the bone qualities.
Yeah.
Why implants? A lot of people say, just take my teeth out, don't do anything, give me a denture. Why? What is the importance of implants? How does implants play a role in preserving our bone? Other than they help with function, they help with cosmetics. But there is untold story that nobody knows about it.
Look at our perfect example. We just had our 48-year-old patient the other day.
Okay.
That came to us for that second consult.
Yeah.
After he was told to have all his teeth out and get dentures.
Yes.
Yeah. He had a lot of good.
Yeah. So So go ahead.
He's a good he's a good example.
So a lot of people end up. So I had actually also a good example. I had a 46 years old. She walks in. She lost her teeth at age 19.
That's
so they
tough.
told her, just take the teeth out, and get dentures. She was happy with the dentures. Here's the trick about dentures. The first set of dentures usually works because you have a lot of bone structure in your jaw, and if you're younger, you get used to it more often.
Right.
So this lady came in, she's 46, so now it's 25 years since she lost her teeth, and she wanted dental implants. There was no bone in her jaw, and the dentures did not work. And I'll be honest with you, the only thing that she wanted is every time she eats, she had every bite, even if she's in a restaurant, she had to go to the restaurant, put a fixed dental on, like every 2-3 bites. And her goal was, she asked me one thing, she said, I'm trying to date, but I will never be able to take, my date, to literally, or think about that I'm gonna be, sharing a room with somebody, knowing that I cannot keep my dentures at night. I mean, she's 46, so, but at that point she had zero bone in her mouth because dentures, they rub your bone down, and you just lose
why
it.
you can't wear them at night.
Yeah, and
a lot of people don't know that either.
They don't know
I have
that.
so many patients that wear their dentures at night, and that'll progress the bone resorption.
If we talk today just about the bone resorption, that would be fantastic.
Yes.
Because
it's so important and it's so misunderstood, and the problem is it has nothing to do with you. The problem is you weren't properly educated to begin with.
And I even add to that, there's a lot of dentists doesn't even know about it.
That's
so it's not
true
even the patient.
too, which is boggles my mind.
Yeah.
It's 2025.
So if you think about it, anything in our body, if you don't use it, you lose it.
Right.
The jawbone is actually built to host the teeth.
Mm-hmm.
And if we take a tooth out, the body will think, well, that area is not needed.
Useless, yeah.
And it actually eats the bone away. We call it a bone resorption. So every time you take a tooth out, don't replace it, you actually will end up losing bone structure in that area, which is the most important bone structure for your jaw to function. And losing all of your teeth out, just what you said, 49 years old, take all the teeth out and give them dentures. 5 years from today, most of the bone there is gone because it's not being used.
I told him I'd rather, if he's not in pain, I told him I'd rather have you leave those broken things in there that are retaining the bone and come when you're ready, because
it is better sometimes to do nothing.
That's so true.
Yeah.
And how many times you go somewhere and it is unfortunate, but yeah, you're in pain, and that's the other thing. If you're in pain, they want a quick fix. You're just like, get me out of pain. And a lot of people tell me, like, I wasn't thinking rationally. I was in pain. The dentist said they can take care of my pain, get the teeth out. And, I wasn't even talked about with implants. I'm just given dentures, told they'll look nice, sent on my way. And this bone resorption is usually not discussed.
Yeah, so, and that's important because it's, so this lady that I mentioned at the 46 years old, the only fix was actually to take bone from her tibia, from her, bone
in her leg,
in her leg, and grab. This is like $100,000 treatment, and nobody covers that. No insurance covers that. No medical insurance. The medical insurance. The last thing they worry about is not your teeth.
Right.
Dental insurance doesn't cover that. Dental insurance sees that dentures is actually the option for you. And I always say dentures is replacement of space, replacement of edentulosum, not replacement of teeth. They will fill the space with something, with plastic, but they will never replace the function of the teeth, cosmetic of the teeth, and that's the point. Now, how do, so losing that bone, let's say we took the teeth out, let's assume that. Now it's proven that bone, as we said, if you don't use it, you lose it. And what's interesting is, the body has receptors inside it. So if you put a denture, it does not receive that as function.
It doesn't stimulate it.
It does not stimulate the bone. It actually end up losing the bone structure.
It's trauma to the bone.
It's trauma to the bone.
The bone
exactly.
defenses itself and backs away.
And backs up, yeah. So that's why your second set of dentures, it doesn't fit any better. The third set, it's worse. It's always, every time you wear a new set of dentures, it's always worse.
Especially the younger you start.
Exactly. Now the only way to keep your jawbone is two things. Either to maintain your dental teeth, because that's the only way receptor, tell the body there is something going on, there is function. And what's interesting, titanium implants, although it's titanium, but because it goes inside the bone, the body reacts to it just like dental teeth. Dental teeth, just like teeth, right? Our natural teeth. And very interesting. So if we take the teeth out and don't replace it, you're destined to lose your bone structure, your jawbone structure. If you replace it with dental implants, the body almost does not know, does not recognize it, that something happened there. And it will say, okay, let's keep the bone. There is function, there is internal receptors is telling me that these jaws are still working, and that way you're maintaining the bone. So if you're 55, if you're 30 years old, if you're 70 years old and I put dental implants in, I know 20 years after, your bone is the same, your jawbone is the same, which is extremely important.
It is important.
I mean,
and and I always tell my patients this. I say, when you see people that have that sunken in look, it's not because of their age, because they've lost their teeth and the bone goes with it. I say it has nothing to do really with their age. Yes, you lose elasticity in the skin and things like that, but I'm talking sunken in look. That's most likely someone who has no jawbone left.
I mean, think about it. What's really maintaining the distance between the nose and the chin is the teeth. There's the only thing. The second you lose the teeth and your bone, when you're closing,
just comes.
That's what we all look older. This actually will add 10 to 15 years in your aging, just looking at it. And it's I enjoy looking at patients when we move them from that
to graduation.
And we graduate them
I'm like,
to
you
teeth.
look 20 years younger.
They do look 20 years younger.
Kevin looks so much younger.
Yeah, everybody.
Everybody really.
They look 20 years younger. Number one, it's almost give you a facelift on your muscles and cheeks and everything. The second thing is it stabilizes the 2 points, which is extremely important, and that's amazing. People just for that. It is amazing.
I don't think people realize how quick it happens. So I've had a couple meniscus surgeries. I used to do triathlons back when I was in shape one long time ago.
You're good. Come on.
But I used to run a lot. Like I was really into it. So I've had a couple knee surgeries. When I had that surgery, I could not believe what happened to my leg because I wasn't using it. It turned in. It was half the size of the other leg. There's a picture somewhere. It was a chicken leg.
You don't use it, you lose it.
The muscle atrophied, and that was within months. You lose the most bone within the first year.
100%. Yes,
I mean, it happens
60% of the bone loss happens the first year.
So I couldn't believe within months I had a chicken leg, and I never thought, I was scared. I didn't think it was ever going to get any bigger, but obviously you train it and you get the surgery and you.
So that's why. So dental implants, they're not just titanium screws we like to put in your mouth, and they're not. No. They're going to do two major functions for you. Number one is they will get you back the function for them, which personally that's the main reason why I do them, is you can chew food, eat whatever you want, get you to the level where your natural teeth used to be when you were 18 years old, not even when you lost your teeth. And number two is cosmetic. You're happy. You're not worried about teeth coming out. You're not worried about emergencies. You're not worried about even dental fixes and keep patching work every few years. So that's the dental disaster, and we move it to this level. It's amazing. Number three, the untold story or the hidden benefit is the bone loss and structure of your jaw in maintaining the bone. So even if extra work is needed, the bone is still there for us. There are actually some studies showing that the bone will grow again if you start using dental implant, which is amazing.
Yeah, I mean, it stimulates it, and the bone's like, hey, there's somebody moved in, I gotta stay, Awesome. Our bodies are amazing.
Good.
And it is. And how, I'd have to say, because we do see more patients over the age of 60, I want to say like at least 40% of my patients have some kind of joint replacement. Yes. Joint replacements that's the implants made out of the same thing.
I mean, our body, we have to respect the fact that our body ages.
It does, and we're so easy to say, I need a new hip.
And that's what most people don't understand. They understand the knee surgery.
I need a hip,
they understand the wrinkles. Yeah, no, they understand the wrinkles.
Oh, that, yeah.
And they're like, at 60, 65, 70, or 50, why my teeth always hurts or why my teeth always breaking? Oh, they age. It's just aging process. So
there's a disconnect, I mean, it is, and that's what we talked about last time too. I want to bring that more into the medical society and have it talked about more, because people are like, they don't question it. Oh, I need a hip. Yeah. It's artificial, because that's a big thing I hear. I don't want anything artificial in my mouth, but most people. Well, yeah. Look, I mean, my mom and dad both had hips in the last couple years. I've never seen them so happy. Their quality of life is so much better.
Interesting enough, since you're talking about that.
Yeah, just because it's the same stuff. Yeah.
So the one who invented, I don't know if we mentioned that last time. The one who invented dental implants.
Yeah.
We did. Is an orthopedic surgeon who was doing some titanium tests, and he's like, maybe knees and all of the titanium plates, and he said maybe it works in the jaw. He did bring 2-3 of his friends put implants in, and it did work, and he was the biggest, most
Right.
important implant guy in the world. He's not even a dentist, which is amazing.
That is awesome. Yeah.
So the first option is replacing the teeth.
Yes.
So the first option is replacing teeth is actually fixed implants. That means that when we say fixed, it's basically we remove everything out, top and bottom, or top or bottom. Every person is different, but we provide fixed implants. Let's explain to our patient what does that mean. How you talk to patients about that.
So basically, I'm trying to restore what God gave you, which is a full set of teeth with full function, and make sure you have a confident smile. The best way to do that, as we talked a lot about bone resorption, that's where the implants come into play, because that's what's going to trick the bone to stay. So you are still going to keep your jaw structure. You're going to have full functioning teeth. The roof of your mouth is not going to be covered like it would with a snap-on denture or a regular denture. You're going to taste your food better. When we eat, we push the food with our tongue up against we mash it up against the roof of our mouth. That's how we eat. Foodies, at least, who really enjoy food, that's how they eat. But the denture, a snap-on, your taste, your enjoyment for food is not the same.
So let's start from function first.
So function, yes.
So if we think about function from 0 to 100, where 0 is no function.
Exactly.
Like you can't even function.
Right.
100 is actually best natural God's work. And this is when you're at 18 years old, you can eat whatever you want, corn in the cup, steak, anything you want, right? And most of our patients, when they show up, they are usually around 45%, 40%, sometimes 30, sometimes a little bit higher.
They're very compromised.
Yeah, so most people is like, hey, I can't eat. I had to cut the food into small pieces. I don't have my back teeth, because most people don't replace their back teeth because they just want to smile about it.
Yeah.
And I can't chew. I can't enjoy my steak. I choke when I eat. I just can't eat anymore.
Right.
So. And then the big question is, if I give you a set of dentures to get an idea, it's the best ever made dentures. It gives you around 20% of your natural function. So dentures compared to natural teeth function wise, it is 20% only. Because the best function, our natural teeth, when if we want to talk about force, we're talking about what PSI is like.
At night, 200 pounds per square inch.
Yeah, it's 200 PSI. 200 to even 300. Okay, denture, the best made denture give you 25. Even if we get it a little bit better, maybe 30 to 50. So that is even 20% less even than your natural teeth forces. So now we're going to be talking about dental implants, and understand that, because if we get you fixed teeth, if we take all the teeth out, put implants in, secure them, and have fixed teeth given to you, we can move you to almost 95% function wise to your natural teeth.
Yeah.
You can basically eat anything you want.
Yes.
You think of anything they cannot eat? I mean, other than chewing ice. I mean,
nobody should
with their natural teeth.
I'm going to say no, honestly. There's nothing, no, and in fact, they don't get cavities, so that's even better.
So they can chew whatever they want. They can eat a steak. Actually, to graduate you from our treatment,
that's fun.
We send you to a steakhouse. You had to eat a steak, take a video, send it to us without having any issues, any pain, any problems. You just chew it, eat it, and you're good to go, just back to normal days.
A lot of my women too, the salads are a challenge.
Yeah.
You know how hard it is? I've sometimes swallowed the salad full, because I'm like, you gotta chew it so much.
Yeah, think about a denture, or painful teeth, or broken teeth.
Lettuce is not easy to chew through, and
salads. What about biting into an apple? The only way to bite into an apple is solid teeth, or solid fixed implants. These are the only two options we have. If you want to get that apple feeling, biting into it without anything moving in the system, these are the only two options.
With 6 implants, I think that's
fixed,
comfortable.
With fixed, yes.
Yes.
With the fixed option, that's what I'm saying.
Option, yes.
That's the only two options, corn in a cup. So function-wise, the nice thing about the fixed option is basically getting you to the level where it's actually function almost to 100% natural teeth. And the good news is, we'll talk about it in the longevity in a second. What about the cosmetic? How do they look?
They're gorgeous. We have a lot of people bring in even like some people, okay, I know we can talk forever, but there's usually a reason, and a patient will justify why they're in the state that they're in. they struggled with drugs, they're sober now. They had a really rough childhood. They were an orphan and they weren't taken to
Their
the
parents
dentist.
didn't take them. Yeah.
Exactly. So, or their parents even, yeah. So you get to that point, and it's just amazing to see them go from that to
And change the look. So cosmetic is
their
top
looks,
notch,
the
right?
cosmetics, yeah. Because I have people say before this all happened in my life, I had beautiful teeth. And
Yeah.
we've had people bring in photos from when they were younger.
Yeah, they're
and try
like,
to match.
this is.
I think someone brought in Whitney Houston once,
Yeah,
and we're
that's
like,
all I say.
we're like,
Their favorite
we got
actor.
it. Yeah, but
You're relatively.
they're beautiful.
The nice thing about
Here's
this
the good
is
part,
you're
too.
building a new house.
Yes.
You're not limited by, if you have a house and it's ready to
Yes.
collapse and
You can customize it.
you're patching you cannot do
mine.
much. But if you just build a new
Yeah.
house, you can build whatever you
Yeah.
want. I mean, we can make them pink teeth if you want. It's
Right.
whatever you want. We don't do pink teeth, but
Yeah,
or Bluetooth.
right.
So it works.
But and the other thing I love too is because this is what we do here. As your implants are healing, it takes some time for the bone to, lock those implants in place. You actually have a fixed temporary, so you get like a trial period to see what you like and don't
Yeah.
like about your teeth. And that's another thing, because people get really afraid of like, I'm stuck with these once they're in. No, you get a healing period. 4 months is a great amount of time to walk around, see what you like, don't like, and then we perfect the finals. So that's the part I loved about the fix.
So the cosmetic, the nice thing about it is, no matter, it will take time to get you where you want.
Right.
And as Therese said, and we'll talk about it in a second about the healing, you will actually number one, you'll go no time with no teeth.
Right.
The second we take your teeth out, you'll be leaving with teeth. And these teeth will be 80 to 85% of how we design them. And you can try them, and then we can improve. We were willing to do anything to get you to the level
won't
that
stop,
till you're happy. It's not like, hey, take your teeth and see you tomorrow. Yeah, I seen people that it's going to take them just an extra few steps. It does not matter at the end of the day, which is extremely important, because I've seen a lot of people who have, I'm fortunate I had to say that, like, this is what we can do, good luck with that.
Yeah.
No, if I'm paying, we talk about money too, it's a big investment. You want to get it right, look nice, function good, and be done with it. So that's number 3.
And we don't compromise. We had somebody that was getting married, and we're not going to cut corners. And unfortunately, I don't think she had her teeth done before her wedding. It was short notice on our end, but
she came 1 month.
Okay, we did
1
not.
month before.
We were not willing to compromise, and in the long run, I know she's very happy about that. And,
she took the decision. She was happy, because here's the thing: if I'm building something, I'm building it for the coming 30 years, 25 years.
Right.
I don't want to build something quick for the coming 2 or 5 years, and then you come back and just start over. It's very hard to start over with dental implants. Want to do it once and done, and don't want to see you again.
Those pop-up houses, Ryan Holmes, I think. I mean, they're just.
So we talk about function.
Yes,
cosmetics,
function, cosmetics,
and you said you will have no time with no teeth. That's important.
No time with no teeth. You get to go to sleep with your teeth in.
Even the healing phase. A lot of people. The nice thing about the fixed option, it allows us to manage the healing phase very well. Because think about it is, and the reason most people think about is like how you can put teeth in the same day. That's a very important question.
Right. People are like, how is that?
The easy way to think about it: if you broke your bone of your hand, you put a cast on it, and what we do is actually when we take your teeth out, we're breaking the bone over there, we're placing implants. We use the teeth as the cast actually to make it solid in there.
Right, and your limited weight, you can so you put a little more weight on the leg.
And then we
foot.
just teach you how to use
eat.
the healing.
And as you go, you get to a little bit more, bigger foods. I think the best thing, because I have a lot of patients that also want to lose weight and their diabetes is under control, they lose weight during this process. And
It's
that's
an
just
added
benefit.
It's an added benefit.
I'm like, take my teeth out because nothing's working anymore.
These are added benefits. Losing weight.
You're just
okay.
free
The
of
second
infection.
one is actually your diabetes gets controlled.
Heart.
It's very interesting because your food, you get better
it's
at
amazing.
eating.
The diabetes is amazing.
Your body's out of infection too. It's just amazing.
It is. That infection and constant source of inflammation these people are walking around in their mouth, it is so strongly connected to the heart and dementia and everything.
So function, cosmetic, added benefits, no time with no teeth, and
good for
the
systemic.
size of the teeth too. So these are actually the closest size we can get to your natural teeth. They're not bulky, like dentures.
That's what people are afraid of a lot.
And we don't cover the roof of the mouth, which is extremely important.
Shape.
It's a horseshoe shape, just match your teeth, natural teeth. And the nice thing about it is basically you go back to taste buds and everything is not covered and you're in good shape.
I think here's another big thing I don't want to forget about. I have so many patients, I have a lot of patients that sing in church, do singing, public speaking.
That's the only thing that works for me.
Your voice with a snap-on, with a partial, with a regular denture, unfortunately, it is going to change the way you sound.
Because that's the one that will give you almost the closest to your natural dentition.
And that's important for.
Yeah.
I have a lot of singers that come in, and
I
that's
agree.
what they have to go with. Like
they play instruments too.
Exactly.
Plus the gaggers.
Oh, I love that too. The gaggers.
So there is people, could be one of them. They gag from just looking at
brushing
the dentist.
their teeth.
Yeah, or brushing their teeth, right?
Mm-hmm.
This is the only option for you. So, and because it is the closest, size-wise, it's the closest that can get to the natural.
Regular denture goes. I want to all the way to the soft palate, which is like the start of your throat. I mean, it goes back there. I wouldn't want to wear one.
Yeah.
So.
And you don't and the best thing is when you go to sleep, they go with you.
That's what I love.
You never take them out. The only person who can take them out is your dentist. So if I just want to summarize things, the main benefits of the fixed teeth, of the fixed implants. Number one is they look like natural teeth. Even better if you want to choose the color that you want. They want you extremely wide.
Lift your lip.
Yeah, it looks super nice.
Looking, yeah.
Number two is function. You can eat whatever you want. Corn in a cup, bite into an apple, a steak. You have complete freedom back into your position. Maintenance is very low. No cavities. You're not worried about cavities. Yes, there is some maintenance that needs to happen, but you're not worried about cavities. We talked about added benefits, losing some weight. And
the gag,
we always joke about it, but diabetes actually controlling your blood sugar because of foods and how you can eat. We see that a lot, and it's actually doing dental implants triggered life's change. So everybody takes like a new habit, bring a good habit.
Right.
And the other thing is for gaggers, for people who sing. The taste of the food is actually, we don't cover the roof of the mouth. The size, they're not bulky. The size of them, they fit perfectly like natural teeth. These are all good benefits.
It's amazing.
And when you go to sleep, they go with you. They don't sleep on the counter. And they are good for 25 years.
They're great.
Minimum. I mean, if you maintain them well, they are actually great for the rest of your life. Right. That's the plan, is to go with the, when you, I don't want to say when you die, you take them with you, but it's actually built to last for the rest of your life.
It's a commitment, it's an investment, but it's one of the things I'm most passionate about as far as it's worth it in my eyes.
100%.
Yeah.
All right. Well, great having you guys.
And please like the video, share it, and leave a comment, and if you ask, we'll answer it.
All right. Thank you.